is Louise Long and I'm the Corporate Director for the Health and Social Care Partnership, who has responsibility for all health and social care community services in Inverclyde. Care coordination means for me that you have one person who is able to support people through their journey through services so that they are able to access support at the right time for them.
My name's Alan Stevenson and I'm the Head of Health and Community Care at the HSCP, and I'm one of the people who's helping to coordinate today's event around dementia. Care coordination for me means that all the services that are available in Inverclyde are working together to make sure that as people need support at whatever stage they are in their journey, that support's there, it's well coordinated, communication works well so everyone knows what everyone else is doing. That's helpful because it means there's no duplication, people aren't having to tell their story twice, and it allows folk and families to have confidence in the services that we are providing across the range of services in Inverclyde for people who are living with dementia every day.
My name is Lynn Flanagan and I'm an Improvement Advisor for the Focused Dementia team, which is part of Healthcare Improvement Scotland, and I'll be leading this project on behalf of Healthcare Improvement Scotland. Care coordination to me is about a proactive approach, bringing together providers and professionals so that people with a condition get the right care at the right time in the right place.
Care coordination to me is about people accessing the right support at the right time and avoiding crisis. So what I really liked about Inverclyde when they applied to be this innovation site was how they involve people with dementia and their carers and staff in how they co-design their services, and I think that provides really good foundation for taking this work forward.
Care coordination for me is so important. It matters so much that people's care is linked up and organisations are linking with each other as well as the carer in the family. It makes things a lot more streamlined for carers. It makes sure that they're not having to speak to 3 different professionals about the care of their loved one and what might happen. Care coordination in Inverclyde, I think, does work well. There is a way to go on it though. I think from the grassroots level, there's good coordination with the community link workers, community connectors, and the third sector. For us at the Inverclyde Carers Centre, we link well with Alzheimer's Inverclyde. We refer to them. We have done cafes where there's a dementia advisor available to talk to people, and we feel that works really well. So when someone's got a concern about a loved one and they just want to kind of run past some ideas they might have, or just for someone to hear some of their concerns and point them in the right direction.
I'm hoping that in the future all the services will actually speak to each other, work smoothly, and it should actually end up seamless so that we just have the one point of contact and nobody has to have the stress of going from pillar to post to get the help they need, because sometimes you just give up and feel like hitting a brick wall. Whereas if we're getting the service, the carers are also getting looked after. It's a double whammy for them.
The project for the future for Inverclyde and across Scotland is, as well as obviously have, so everybody has a diagnosis, of a dementia of some type as well, as a lot of people slip through the net. I think so. This is where we have to start and work from the beginning to obviously be able to give, if you have some kind of ailment, whether it be a heart condition, or then there's a diagnosis given, and the diagnosis helps those to kind of accept and work. So where I see we have to be going in the future is obviously to be aware and give pointers to what support's there for individuals who have a diagnosis.
The future of this for us is really to build a coordinated model within Inverclyde that has good data from preventing admission to hospital, from supporting people within the community, from services, and from a coordinated and co-designed approach where people feel that's a positive support. We would then, we are looking to build that into the other HSCPs in Greater Glasgow and Clyde. So we have 5 other HSCPs that all have different levels of dementia services, of coordination, of bed-based models, and we're looking to co-create, share the learning as we go down this journey for Inverclyde. And also, obviously, I think from a Scottish perspective, we're keen it's a beacon for Scotland, and we're trying new innovative things that can be shared elsewhere.
I think the benefits for Inverclyde and for Scotland is just a great opportunity to really test a way of working that we have tested in Scotland, but we've not done a whole system test. So really working with a group of people, looking at what great dementia care could be and should be in Scotland, from pre-diagnosis and right through to end-of-life care, and really working with a group of really committed staff, motivated carers and people living with dementia. We're here today to get the best coordinated services that we can do within Scotland, capture the best of, and really learn about maybe what's not so good, but what could we do differently and better. And to do that together with the expertise of both people living with dementia, family carers, our improvement experts and focus on dementia, and our health and social care staff and our Alzheimer's staff, particularly in Inverclyde, and then share that learning, both in Scotland and I think wider as well. I think there'll be a lot of interest in the learning from this project in particular.
I think it's really exciting that Inverclyde is involved in this process, and that we can really try to embed a lot of practices that are talked about across Scotland, and hopefully things that are started here can then be used across Scotland. For me, it is about improving that transition. It's about improving that journey of care, both from diagnosis, from pre-diagnosis, right through to end-of-life care. And it's also about ensuring that you have access to a whole range of professionals throughout that, and that includes physiotherapists, and ensuring that dementia is seen as a reason for rehab and not always a barrier to rehab, to really ensure that people who need it get the care that they need from all the professionals involved throughout their lifetime.